Most women with large breasts think it's just their lot in life to have these large breasts and to deal with them every day. And they really start to even discount what they do to deal with them. They just lose sight of the fact that they're now wearing 2 sports bras and they're buying dresses that are 2 sizes bigger than they need, and that they're going to wear layers of clothing to hide the fact that their breasts are large, and that they stopped running because they no longer can run comfortably. So they just really, you just start to, add all these little pieces on, and you assume it's just how life is, but it's not. A research study that I did a number of years ago actually quantified the amount of health burden that large breasts cause, and it's really equivalent to knee arthritis. It's a very substantial impact on people's health that they're often not aware of until after their surgery. In the year 2000, I published a paper called The Health Burden of Breast Hypertrophy. It was actually, it's still today one of the best studies on the impact of large breast on patients' health. So we used both patients who were presenting, large-breasted women who were presenting for surgery, and a control group of women who were large-breasted and weren't coming for surgery. And what we identified was that both groups really suffered a significant amount of health burden, equivalent to knee arthritis, if they had breasts that were D cup or larger. Now, we also found a subset of women who were maybe D cup who actually didn't have symptoms. So we're not suggesting that every patient with large breasts needs breast reduction, but the ones with symptoms who may not even recognize their symptoms are the ones that we would love to talk to. I think some would be very obvious, grooving of their bra straps into their shoulders so deep that women have permanent grooves in their shoulders. Neck pain, back pain, inability to do physical activities, having to modify what they wear to conceal their breasts and make them not such an obvious part of their appearance. Headaches, some people don't recognize that they have basically chronic headaches, and it's because of the strain that they're putting on their neck. I often, for someone who doesn't have large breasts and doesn't understand it, try and say, imagine if you tied a 5-pound bag of sugar around your neck and hung it there for even an hour. I think you would really quickly understand why it has such a significant impact on women. I think when most people think about plastic surgery, they think about Dr. 90210, cosmetic surgery for good or bad. But the reality is most of plastic surgery is reconstructive. And so my practice, I would say, is probably at least 95% reconstructive. And that includes reconstructing women who've had breast cancer, who've lost their breast or a portion of their breast, women who are born with a very significant asymmetry of their breast size or shape. Those are all reconstructive surgeries. Cosmetic surgery is when you take normal and try and make it better. Reconstructive is when you take something that is no longer normal or never was normal and try and make it normal. And that's a big distinction, and it's an important distinction because reconstructive surgeries, by and large, are covered by insurance, as opposed to cosmetic surgeries, which are self-pay. So I think it's important for women to know that in my experience, 95% of the time, patients who present with symptoms of large breasts are covered by insurance for the surgery to reduce their breast. At Dartmouth-Hitchcock, I was involved in teaching residents and in research and many other things. And so as a result, I didn't really get to see my patients as often as I would like. I wasn't the person who necessarily answered their questions after surgery when they had concerns. Now, because it's just me, it's always just me. Right? I give them my cell phone number after I do their procedures, and I encourage them to call me if they have questions, and I really like having that connection. The most important question you can ask your surgeon is, how many of these have you done? Because there's a very strong correlation between the outcome and the number of procedures that you do. I ran the breast cancer program at Dartmouth-Hitchcock for 10 years, and really, for the most part, my practice has been exclusively breast surgeries since about that time. How many have I done? So many that I couldn't possibly count. I know I'm in hundreds and hundreds. Am I in thousands and thousands? Maybe. Probably, and I still find it just as interesting now as I did when I started. I think the one thing that I just hear over and over from my patients is, I wish I'd done it sooner. It's so life-changing, and once they do it, they're so delighted, and all of the fears, all of the hesitations that they had beforehand, they just regret that they didn't make that move sooner. Breast reduction surgery is considered one of the most routine things a plastic surgeon does. Not everybody gets as excited as I do about it. But I know it's life-changing. I know what it can mean to a person, and I want it to be perfect. I want it to be perfect every time, like every detail. So I'm kind of a perfectionist there.